الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Rhinovirus or common cold by Professor Mahmoud Hani Sulaiman. Definition: Rhinoviruses are the most frequent causes of common cold. Common cold. Rhinoviruses cause combinations of sneezing, sore throat, rhinorrhea, nasal congestion, and coughing. Epidemiology. Rhinoviruses are among the most common human pathogens. Rhinoviruses lead to 0.75 infections per year in adults and about 6 infections per year in children. Infections occur year-round with seasonal peaks in spring and fall. Seasonal peaks in spring and fall in temperate climates. Spread occurs by hand to nose or hand to eye contact and by aerosol. Spread occurs by hand to nose or hand to eye contact and by aerosol. Microbiology. Rhinoviruses are single-stranded, non-enveloped RNA viruses. In family Picornaviridae, there are 3 species, RVA, RVB, and RVC, which have at least 156 serotypes and genotypes. Pathogenesis of common cold showing stages from infection to recovery. First, upper left, during infection, rhinoviruses invade mucosal tissue. Rhinoviruses invade mucosal tissue. Then, 2. Viruses adsorb to nasal epithelium. 3. Viruses replicate and are shed. Viruses replicate and are shed, causing spread of infection. 4. Antibodies and interferon facilitate recovery. Antibodies and interferon facilitate recovery. Infection ends and epithelium regenerates. Clinical manifestations. Common cold is the most frequent illness. Infection increase asthma, chronic pulmonary disease. Infection can be associated with otitis media and sinusitis. Lower respiratory tract disease, including pneumonia, can occur. Infection is more severe in immunosuppressed patients. Typical clinical manifestations include sore throat, nasal congestion, nasal discharge that initially is watery and clear but often becomes mucopurulent and viscous after few days. Malaise, headache, myalgia, low-grade fever, cough, and sneezing may occur. Malaise, headache, myalgia, low-grade fever, cough, and sneezing may occur. Symptoms typically peak in severity after 3 to 4 days. Peak severity 3 to 4 days. Have a median duration of 7 days but may persist for more than 10 days in about a quarter of illness. Diagnosis. Specific virologic diagnosis made by detection of virus in nasal secretions or pulmonary samples. Virus detection in nasal secretions as aspirates, swabs, washings, or pulmonary samples. PCR is the most sensitive and lab for virus detection. Therapy. Common colds are self-limited, but symptomatic treatment used to provide relief. Antiviral therapy is not available till now. Treatment is supportive. Antimicrobial agent should not be used for prevention of secondary bacterial infection because use of antibiotics may promote emergence of resistant bacteria and subsequently complicate treatment for a bacterial infection, and because of the risk of antibiotic associated side effects. So do not use antibiotics in treatment of uh, common cold till the fever is more than 39. Then the case may be bacterial infection after on top of rhinoviruses. Prevention general measures as good ventilation, isolation, standard precautions. We have a lecture for standard precautions. No established specific method of prevention exists. Vaccines are under active investigation. Vaccines of rhinovirus. On discovery of rhinovirus more than 16 years ago, it was associated with great interest in development of vaccines. It was recognized early that presence of rhinovirus serotype-specific neutralizing antibodies was associated with some protection against infection with homologous but not with heterologous serotypes. Early trials with formalin inactivated rhinoviruses as vaccine candidates given intramuscularly or intranasally showed protection against homologous virus in terms of decreased of symptoms but not decrease in rates of infection. However, the multiplicity of rhinovirus antigenic types presented a major barrier to development of vaccines since those early studies. Molecular studies identified a region of N-terminus that can raise type cross-reactive neutralizing antibodies, and this query useful as vaccine candidate. This may be used as vaccine candidate. Use of modern techniques led to generation of polyvalent rhinovirus vaccines with up to 50 valent composition, 50 valent, which is broadly immunogenic in non-human primates that are undergoing further development. Till now, no vaccine, it is under development. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.